Higher education, it doesn't look like it did 20, 30, 40 years ago. The number of students enrolled has declined, the cost has increased, there's new technology, and there's new majors that you can choose from. And you shared so many important facts today that the distribution of higher education institutions across the Commonwealth reflects our history and not our need. And we have seen massive drops in student enrollment. I think since 2010, we're down about 29%, almost 35,000 students. This fall, we saw a drop of about 5,000 students. This is a national enrollment trend. So post-secondary institutions across the United States between 2020 and 2028 have seen a 3% drop in enrollment. We have to figure out a way that we can stabilize the enrollment decline. And I think a lot of that goes back to course majors. I co-chair the Senate Manufacturing Caucus. There are so many employers in my district that are looking for workers that have the skills that they need. You've done a good job at micro-targeting different sectors. Can you tell me how you make decisions as to what areas are in demand with employers so that you can tailor those micro-certificates and different coursework to meet the needs, connecting employers with a skilled workforce?
Yeah. So, the great thing is that all this wonderful work happens at our universities with our faculty, mostly in terms of program development, and they're great at what they do, including our counselors, by the way. They're fantastic. We supply them with good data and then an approval process, which basically asks questions about demand and show us in the data where the demand is and what you expect it to, how you expect it to impact things like enrollment. We work closely at the regional level, something we organize at the state system level, through what we call regional assemblies with employer groups in the high demand areas, healthcare, IT, et cetera, advanced manufacture, to understand what employers, who our data tell us one thing, employers may give us some flavor to that, and so the two things together help us help the folks who are planning our programs identify where the real need is. And it seems, I track it at this, you've seen it in some of the data we produce. It works. You see, we are responsive to need, so it's cool.
Which is important. So you requested $112 million for direct to student funding for those pursuing certain in-demand areas that you've identified through this data-driven process.
Yep.
And you shared how you go about making that determination, and I appreciate that. I want to talk to you a little bit about your plan to address the nursing shortage. There will always be a need for nurses, nurse practitioners, physician assistants, keep Pennsylvanians healthy. And when we spoke earlier this month, you were here in the Senate, it was mentioned that PASHE cannot pay the clinical fees because they would pass the cost onto the student and students could not afford it. So I'm not familiar with what those clinical costs are, who pays them. Are other schools and programs covering those clinical costs?
Yeah, two of the bottlenecks, and this is true across the industry, but as I understand it, two of the bottlenecks are availability of nursing faculty, hard to come by, and availability of clinical placements. And the clinical placements do, and this is true with the physician assistantships as well, they do have a cost to them. And that cost is typically borne by the will be borne by the education provider in whatever way it can bear the cost. And what we're trying to do is to make lower cost options available because we're a public university. And so it's finding those clinical placements that are affordable is a challenge.
Is that something that the General Assembly can help connect your institutions with our institutions of healthcare?
So I think this is one of those problems which is ripe to bring stakeholders around the table and have this conversation. Like we have, especially in nursing, we have these tremendous gaps with hospitals paying 3 times over the odds for a traveling nurse, right? And so everybody's got a real vested interest in solving this problem. So I think bringing folks together around the table to begin to identify where the pinch points are and what are the practical means, whether through state investment or other ways, we can begin to reduce those bottlenecks.
So if we could go back to that 112 million, what would those direct student funds cover? Is it going to be their expenses, just tuition? Will any of that $112 million be used to cover those clinical costs for nurses?
So think of it as a student financial aid. So if it's a Pell student, it would be up to $5,000 directly to the student to pay their tuition and fees, room and board, et cetera. If it's an so think about it that way. And $1,500 if it was not a Pell student, simply to lower the cost, overall cost of attending nursing.
Very good. I do want you to know that last year in appropriations, we got some movement. That state nursing board was really a bottleneck on those programs approval for nurse educators. And we were able to make some progress in that regard, but your concern is duly noted with the number of educators as well. So thank you very much, Chancellor. Thank you, Mr. Chairman.